Hi everyone, in this video I'll talk about aplastic anemia. So, what is aplastic anemia? About its complete overview, about its causes and symptoms, about its diagnosis, how to treat and manage this condition, how to prevent it, and what are the prognosis of this disease, and some additional common questions. So, we will discuss all these things in this video. So, stay with us till the end. So, the aplastic anemia is a very serious blood disorder. It happens when your bone marrow can't make enough blood cells and platelets. People who are diagnosed with aplastic anemia have an increased risk of serious infections, bleeding issues, as well as the cardiovascular diseases and its comorbidities. They are very prone for developing the heart attack and the heart failure. Now, let's have a look at the prevalence of this condition. So, around 300 to 900 people in the US are diagnosed with aplastic anemia. So, around it affecting the two every people in 1 million of a population. So, it is affecting basically 15 to 25 years of age group or sometimes above the 60 years of age group. Now, the question is that what are the signs and symptoms? How will you get to know you are developing the symptoms of the aplastic anemia? So, if you are having a frequent viral infections that stays for a longer duration of period, if you have a skin color change, you have headache, fever, bleeding time is increased, and you continuously feeling the fatigueness. So these are the few symptoms, but most importantly, if you are having cold or the flu-like symptoms, which are quite common and which are very frequent, then it doesn't mean that you are having aplastic anemia, because for confirming the diagnosis of aplastic anemia, there are certain tests that needs to be done to make it confirm. So it's always better, if you're having the symptoms of cold and flu-like symptoms, you should talk to your healthcare provider so that they will help you to diagnose it, either you have it or not. Now let's have a look at what causes actually aplastic anemia. So it's quite your own immune system is attacking your bone marrow cells so that it can't make the stem cells. So other than that, there are certain medical conditions also. For example, if you're having any autoimmune disease, if you're having paroxysmal nocturnal hemoglobinuria, if you are pregnant, so there are certain other medical conditions are also responsible for developing the aplastic anemia in any of the people. Now, other than that, there are certain viral infections, for example, Epstein-Barr virus and the cytomegalovirus, or maybe the HIV. It also affecting your immunity, so that is the reason of developing of aplastic anemia in so many people. Anemia, severe infections, excessive bleeding, arrhythmias, or the heart failure. So these are the few complications of this condition. Now look at the diagnostic pattern, how we can diagnose it. So to diagnose this, we can take help of CBC, that is complete blood count. It help you to measure the different parameters of your hematology. Next is a peripheral blood smear test. Next is a reticulocyte count, and the next is a bone marrow aspiration. Now look at the treatment. There are certain immunosuppressants are also provided to the patient. Blood transfusion is done to the patient. Antibiotic therapy are provided to the patient. Anti-allergic are also provided to the patient to reduce the symptoms of allergy while transfusion of the blood. So this is all about your aplastic anemia. I hope you like this video and you have subscribed to my channel. Thanks for watching. See you in the next video. And if you have any doubt or the query related to the video, please let me know in the comments.